recording the call. If there's something that you don't feel comfortable asking on the call, we are going to be taking questions via email. So feel free to send us just in that different venue if you'd like. So I'll start off with where to find this application information. So it is on IHCDA's webpage under Newsroom and Public Notices. This is Public Notice 21-12, and it'll be posted there throughout the lifetime if there's anything that we add to that. And when we do post answers to questions, we are going to post it there. All right, from IHCDA on the line today, you have me, Emily Krauser. I'm the Director of Community Programs, and we also have Veronica Watson, who is the Manager for CSBG, which is the funding source for this award. So as we get into questions, either one of us might answer you. I just wanted to make sure you were aware that there was another person on the line with me. Great. I think that's all my introductory info. I'm going to run through a few key points that we think are really important for everyone to know. And then I'm just going to open it up for questions from everyone. So here are a few key points. The funding source for this grant opportunity is Federal Community Service Block Grant CARES Act funding. And really for us, that means two things. For CSBG, which is Community Service Block Grant, that is intended to be used to alleviate the causes and conditions of poverty for those who have incomes at or below 125% of the federal poverty level. So that's the CSBG portion. And then the other portion is that it comes from the CARES Act. And all funding provided through CARES Act is to prevent, prepare for, or respond to the COVID-19 pandemic. And so we have kind of both of those sides going into this funding source, and all of this that I'm going to walk through on key points is written in the application instructions document. So it shouldn't be new, and if you need a recap, that's where it is. So these funds must follow, because it's federal funding, must follow 2 CFR 200. For those of your organizations that are used to doing that, it will be similar. And then also for you all to know that this is reimbursement only. So unlike a regular grant where you get the funds straight away and can start using them, we work on a claims system that does require documentation that you're utilizing the funds in the way that you said you would. So that is something important to know as you're deciding whether or not to apply. I wanted to tell you a little bit about what IHCDA hopes to achieve with this. So really three main things. We're hoping to showcase clear and measurable impacts as a result of this grant. So we identified some outcomes that we want to show those impacts on. But for us, we want to be able to show that and to show the change or the difference that we made in Indiana. We want to be able to collect and incorporate lessons learned, both about the process that we're going through now, funding, doing kind of a general open call for applications, as well as within the projects. We want to take those lessons learned and apply them back. And then we'd also like to just continue building relationships with strong organizations across Indiana, working to alleviate the causes and conditions of poverty. I have just a little bit about what the grant provides. So it's a 1-year term from September 1 of 2021 to August 31 of 2022. We will provide up to $100,000 per application, and up to 20% can be used in administrative expenses. And IHCDA is also going to be providing the evaluator for this. So you don't need to include that in your program costs. That's something that we're going to add on, working with an evaluator of our choice as part of this opportunity. All right, eligible projects. You do not need to have a previous relationship with IHCDA in order to apply or be taken seriously for this. If you do have a previous relationship with IHCDA, we just ask that you be in good standing, and we'll make sure that you are, if you're applying and you have a previous relationship with us. The project that you apply for needs to be in response to a documented community need. And yes, it does need to be documented somewhere. We're pretty open. The sources, some of those ideas are listed in there, but it does need to be a documented community need. And the project needs to reasonably be expected to meet a target goal for one of the outcomes that are listed. So we are looking for each project only that's applied for to only address one of those outcomes. We don't want, we address all three, so we're doing better. We don't care. Focus on one. And then within that target goal is going to need to be met within the project period, which is a pretty short timeline. It's a year. Like I said before, and we understand that what we're asking, like the outcomes are not things that can be created necessarily in 1 year alone. So we're hoping that some of you are already, starting down the path of some of this already. But we are going to need to see that the target that you list in your application is doable within the time period of the grant. And it is up to the applicant to define how the outcome will be measured. So I know there are likely a lot of, well, how is this supposed to be measured? What do you mean by this? We are looking for you all to define exactly how that outcome is going to be measured. And also what the target goal is. That's for you to decide what that target goal is and to convince us that it's doable within that time period. And then we are also not specifying what type of intervention needs to be used in order to meet that outcome. So we're interested in the outcomes and will accept many different ways to achieve that. The funds need to be spent to serve people under 125% of the federal poverty level, and it must directly respond to the effects of COVID-19. So the last section that I have here to tell you all before I open it up for questions is just a couple of notes from me on applying for the award. So first is follow directions carefully. We're going to be on a pretty tight turnaround to get these out to our board. So we will be scoring the applications as they are turned in and will not have time to reach out for additional clarification to you all. So please follow directions carefully. Make sure you get it in complete as you would like for us to see it. Also pay attention to the page limits and the required content. We will disqualify agencies that don't follow the rules. We anticipate that we'll probably have quite a few applicants. So we want to make sure to be fair to everybody and make sure everybody's following those rules. We are taking questions via email as well as during this call, and we will post the answers to all questions, including what we talk about during this call, live before the applications are due. On page 7 of the application instructions, there's information on where to get those answers as they're posted. So questions will be accepted through June 11, and answers will be posted on June 14. And then, of course, the application is due by 5 p.m. Eastern Standard Time on June 21 via email, and late applications will not be accepted. All right. That's what was on my list to make sure I told everyone. Veronica, am I missing anything that you had hoped I'd say?
Not that I can think of.
Great. In that case, I will go ahead and open for questions. We do have quite a few people on the phone, so just be respectful of each other. And the way that you unmute is you hit *6 and then make sure it's unmuted on your end as well. But you can unmute on our end by hitting *6.
For those of you who are logging in on your computer, you can also hit the microphone. It should be in the top right corner to unmute yourself, and then please mute yourself once you're done.
Hi.
Oh, I heard you for just a second.
It's Maureen Shepard with Tulip Tree Family Healthcare.
Hi.
A general question. Are you hoping to have fewer grantees with a larger amount? Or if some people ask for less than 100,000, are you going to get more grants?
That's a great question. We will entertain all of that. We do have a specific budget that we need to hit, but we are anticipating fewer applicants with larger grants, but are open to something else should they come in.
All right. And on the mental health piece choice, it would be somehow focused on mental health needs due to COVID concerns or issues. Is that correct?
So either the mental health need itself could be due to COVID-19, or the need for mental health services might be increased due to COVID-19, but the actual issue itself isn't related. Does that make sense?
So building capacity in general could be seen as a need.
As long as you're making a clear connection into why COVID-19 affected the situation that required more individuals to be served.
All right, thank you very much.
Mm-hmm.
Hi, this is Chris Metz from Echo Housing. Quick question. I don't see anything in the RFP about any specific costs that would be eligible or ineligible. Are there any costs specifically? You did say that up to 20% can be admin, but are there any specific costs that we should be aware of today that would be ineligible?
That's a good question. So we are going to need to follow federal guidelines for CSBG funding generally. And then Veronica, did you have something to add on that?
No, I was just going to speak to that.
Great. So yeah, we're just following CSBG funding rules, 2 CFR 200 for federal funding, but there are no specific ineligible costs outside of what is allowable by federal funding.
So for CSBG, a big one is property. You cannot purchase or permanently improve property with CSBG funds. So those costs related to that would not be eligible under this project.
Good addition.
Or registering voters, which I don't think relates to any of our outcomes, but nothing about registering voters, even if it's a nonpartisan effort. That's another CSBG no-no.
So, Chris Metz again. Well, you said the improvement of property would be an ineligible cost. Let me give you an example. What about the retrofit of a vehicle to turn it into a mobile COVID vaccine clinic? Would that fall under that heading of improving property and thereby being eligible?
Property is normally associated with real estate. So when we talk about property, we normally mean like buildings. I will need to double check on anything related to vehicles. If you could email that to me, and if anyone has similar questions, I can make sure we'll add that to the Q&A that gets posted. But I don't believe that would fall under the same rules, but I need to double check on that.
Hi there. I have a question. So,
hello.
This is Mariana from La Plaza. With regards to the different project outcomes, mentioned focusing on one, and of course there are 18 months during the grant period. If, for example, we're hosting like vaccine clinics and we want to focus on access to COVID-related health initiatives, say we are like a clinic for Moderna or a Pfizer vaccine, and like the first half of like expenses are like right before the grant, but then like when we have our partners come in to administer vaccines here at La Plaza for the second half, would we only be able to use grant money for, say, like staff time for that second dose, or could we also apply it to like the week prior to when I guess the 18 months grant didn't start?
So the grant can only cover activities that are happening during the grant period. So we'll need to show that the activities are happening during that grant period once it's achieved. And then for anything that is an ongoing or existing program or initiative, we'll just want to see in the application how this funding would allow more to happen than would have happened otherwise.
Got it. Okay, thank you.
And I'll jump in and say that the grant period is 1 year. It goes from September through the end of August. There is a reference to 18 months in the application. That is in regards to the documented need and the documentation you need to show the need that you are addressing with your particular project. You can use your own research that was done in the previous 18 months of you applying. But the actual grant period and the activities taking place therein cover 1 year.
That makes sense. Sorry. Thank you for the clarification.
I have a question. I'm Lindsay Sarver from Acre House in Seymour. One of the programs that we have and that we're developing is what began as an overnight shelter, but we're working toward transitional housing. And one of our ongoing projects is creating a kind of mentorship continuation to help the gains for financial savings and finding housing continue beyond the 12 weeks of our program so that we can continue to track that through the end of the 6 months. Are we eligible then to seek funding not only for the 12 months itself, and then as we kind of taper off those services to give them more and more independence, kind of process that way through, or do we have to demonstrate that they would be living with us for those 6 months? Because our program works with our regional rapid rehousing coordinator and so forth. So we're kind of the entry stage of that program, but they don't stay on our premises for those 6 months. Is that something that's still eligible?
Yeah, we're going to be looking for the funds being spent during the funding timeline, but in terms of how the program is laid out and where people are at any given time, that would be up to you as long as the funding was spent in the right timeline on our end.
Perfect. Thanks so much.
It's Timothy Weir in Evansville with the Commission on Homelessness.
Hi.
I have a question. Hi, I have a question. About the intention for the grant. Is the desire to prompt the creation of ongoing program or service delivery, or to specifically address an identified short-term need in the community? And it seems that you're open to both. Can you give us any feel for your view on that?
You're definitely right that we're open to both. I think we have a tinge of realism that while we very much want this to be based in a community need that was identified and that you're fulfilling, we realize that in order to hit an outcome, a target outcome in 12 months, you probably have already been doing this. And so we are open to both because we understand that our timeline is pretty short.
Thank you.
I'm not seeing other questions. I'm happy to give you all the rest of your hour back, but I want to remain open just a little bit longer for those of you that do have questions.
Hi, sorry, just a follow-up clarification on that one then. So the grant funding must demonstrate how it's supporting activities that wouldn't have happened otherwise, though. Is that the clarification? Just trying to make sure I understand that correctly.
So we want to make sure that this funding source is adding value in some way and is addressing the needs in the community. It very much is a funding, I'm sorry, there are sirens. It's very much a funding source intended to fill gaps in communities and to fulfill specific needs that other funding sources aren't filling. So we will be considering that as part of the kind of systems that are happening in the areas that are applying.
Okay, thank you.
Just a secondary clarification question. I know you mentioned that we need to really focus on one specific target outcome, which we already have designated, but part of that focus and development for us involves improving systems coordination between agencies because there's so many people who are involved in wraparound services. So while we would be targeting our application to demonstrate that we're seeking to alleviate a particular community and family issue, is it all right to then put into our budget that part of that budget would be improving that systems chain management, as it were, so that we have a better streamlined process throughout? Or do you even not want reference to it in our application so we explain why it looks like that's happening?
Yeah, this is a funding source that looks favorably upon systems of care and coordination of care. So I think that is something that we'd be open to seeing in those applications.
Great, thank you.
All right, I'm not hearing any additional questions, so I will remind everyone that if you do have something that you want to ask via email, you're welcome to do so. The address is in the application instructions, and then there's a deadline for that. I believe I said June 11 for those questions to be answered, and then we'll post everyone's answers on June 14 on the same website where the information is posted now.
I'll go ahead and add that we'll go ahead and post a written overview, there go my lights, of the questions that were asked today and then our responses and potentially elaboration on any of our responses by the end of next week. And then we will update that same document with any additional questions that we get via email by that June date. But just so that if anyone wants to reference any of the questions that were asked today, we'll make sure that those get posted on the public notices page where the application and there's one other document listed there. I can't remember what it is. The agreement. So we do have a copy of the agreement that we would have any awardee sign. So make sure that you've taken a look through that. Our legal department does not look favorably on changing those agreements, so don't expect too many negotiations on that, but it's still good to review and make sure you understand what you would be signing up for should you receive an award with us. But we'll post the Q&A document there, the first version, by the end of next week.
Great. Thanks, everybody. Thanks for hopping on. We look forward to it.
Thank you.